Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response. And true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. Hi, and welcome back to the Vital Spirit podcast. I'm Dr. Kelly Livingston, and this is part 2 of what do we do at home when we have an acute illness, sickness, infection. How do we care for self at home with natural remedies? So we're going to move into the part that makes a lot of patients the most uncomfortable, basically, because once an acute illness is clearly underway, most people stop trusting the body. This is when your fever's rising and your throat hurts more, and we've got that painful, raw feeling in our throat, or our body aches, or our ear infection is just so painful, or the mucus production is increasing. We're so congested, we can't breathe, we sound really nasal, we have a headache, our energy is dropping, our appetite is shifting, we are getting sick. We've got the chills and we want to be under blankets, or we feel like we've been hit by a truck. And this is the moment where patients decide something has gone wrong. I need to stop it. But very often what has actually happened is that the body has just committed. The body is now past that early signaling stage that we talked about in the last episode, and it's signaling into full immune activation. This is something that I actually celebrate. I'm not saying to be sick forever. I'm not saying to be extremely uncomfortable and have an excessively high 110 fever and don't do anything about it. Not at all. We have to have discernment. We have to know what to do in these situations. I help patients through that so that they can then be empowered to do this at home on their own. But I applaud when the body is activated because it tells me the body is responding the way that it should. Your terrain is really smart and it's doing what it's meant to do. And that is so important because once you understand that, you stop asking the body to act normal while it's doing something extraordinary. And you stop trying to force normal appetite or the productivity you usually have in a day, or normal output, normal energy, your typical daily routine. And you start to recognize, okay, step back, I'm feeling sick. And you start to ask a much better question, which is, what is the body accomplishing right now? And it's not, how do I make this go away faster? How do I shut this down? So again, if you're going to reach for an over-the-counter, like an antihistamine or an antibiotic, it is typically shutting down the process that the body is trying to do. So instead, we're asking, how do I support this process intelligently? And that is true acute naturopathic care. And that is the therapeutic order applied at home, right? Remember, recognizing and removing obstacles to cure and supporting the body's response. So fever is really a great example of where this needs to be reclaimed, because fever is one of the most misunderstood physiologic processes we have. It is not the enemy. It is not a mistake. One of the biggest shifts I help patients work through is learning to not suppress their fevers. Fever is not a sign that the body has become dangerous to itself by default. Fever is a coordinated immune strategy. It is a really important immune strategy. You are turning up the heat in your body to make your internal terrain less favorable for pathogens and more favorable for immune activation. And this increases immune efficiency. So again, the moment I feel like I'm coming down with something, I am in that hot Epsom salt bath. I am turning on the fever heating process. I am turning on heat shock proteins. This is important. By changing that internal environment, I'm enhancing the activity of certain immune cells and I'm helping the body mobilize. I'm moving things through, right? Is this costly? Yes, it requires energy. It requires fluid. Remember, we talked about that in the last episode. It requires resting, but it is purposeful. And one of the reasons acute illness often gets so prolonged, and patients will say, I've been sick for weeks, is because we interrupt that process way too early, too often, and too reflexively. We grab something that turns that process off. That's not what we want to do. Now, that does not mean that every fever should be left alone no matter what. Please be responsible. This is not medical advice. This is an educational podcast. That would be careless and simplistic. We use judgment. We look at context. We look at the whole person. We look at their age, their resilience, their symptoms, their hydration, their breathing, their level of responsiveness, their pain, their overall picture. I'm very often asking a mom, is the child lethargic? Are they communicating? How high is the fever? I'm not saying to do this irresponsibly, but in general, a healthy person with a moderate fever during an acute infection is exhibiting exactly what the body is meant to do, exactly what the body should be doing, and we want to support that process. And so the work becomes supporting you through the fever, not panicking because the fever exists, and definitely not just turning the fever off. This is a really different perspective, right? It means you support with fluids, warm fluids, broths, ginger tea, lemon water, herbal tea, coconut water in the right context. You rest, you keep the room calm, you don't force heavy meals, you allow the body to redirect that fever into what it is meant to do and turn on the immune system. Very often in this phase, we might notice that our appetite drops. And so we're attempting to get some food as medicine into the system in other vehicles, such as bone broth with lemon and maybe lemon and honey, or if we have a cough, maybe a honey and flax syrup. I will often keep an onion, garlic, honey mixture on my counter that I make every year. And you might be taking some little teaspoons of that throughout the day. We're essentially listening to the body as far as appetite goes in this phase. And if someone is not very hungry, I'm usually not forcing food, but I am paying attention to hydration. So again, broths or stewed apples. If we have a GI upset as part of this acute phase, maybe we're using bananas, rice, apples, and toast if that sits well. Usually I'm doing gluten-free toast with my patients, but the point is easily digestible foods. And sometimes, as I said, just honey and warm water and diluted juice for a while and things that are easy for the body to absorb and get nutrients from. I do find that every patient has a different response in how appetite goes during this acute phase. So again, it's really more about keeping hydration in place and really gentle, soothing, easy to digest foods. Soups and stews are a great idea. Now, maybe as this is progressing, again, it might be fever, it might be sore throat, might be a GI infection, but you might experience something like a phase of the chills. This is really important. So when the body is mounting a fever, we often get cold first. You'll feel chilled. You'll want blankets. You want warmth. You might be shivering. Your hands and feet might be cold. And that's definitely not the time to put you into an ice bath because you're afraid of the fever. It's the time to understand that the body is still building heat and reorganizing circulation. So at this point, you might feel like you need warmth and warm socks and blankets and teas and a hot water bottle, a bath. But we're also going to consider using hydrotherapy to move that phase through. And once you've moved through the chills and maybe you're now sweaty and hot and flushed, then we might think a little bit differently. We might focus more on cooling in a cold compress or light clothing, getting out into some fresh air. So you're really working with the stage that your body's in when you're choosing what natural tools to use to support the response. So much of home acute care really is stage recognition, pattern recognition, and matching the intervention to the phase. So, this is where hydrotherapy is such beautiful medicine because water and temperature are really active controls and levers that we have around our immune system physiology. And water and temperature are going to influence circulation and movement of our white blood cells, red blood cells, all of the cells that are recruiting active immune stimulation to different areas of the body. And they're going to influence our autonomic nervous system state, just our overall immune function in general, our muscle tone, our elimination. So, as potentially infections are dying off, they're also needing to be detoxed out of our body. As our immune cells attack something that's coming into our body, we then have to release the things that we've given off as a response of that attack. So, say you have a bacteria or a virus in your body, as it dies off, you have to process and eliminate those die off toxins, right? So, I want to teach this phase correctly because very often we're talking about hydrotherapy in clinic, and I have time to walk patients through what we're doing, why we're doing it. And so I just want to mention some of those today before I jump into how do you do hydrotherapy at home. So, one of my favorite hydrotherapies in this acute phase of healing is called the wet sock treatment or magic socks. It's one of my favorite handouts to give. And it's one of the ones that I say to people, look, you might not want to do this at first, or you might not understand it at first. But then when you do it, you're going to say, oh my gosh, this is magical. Why didn't I know about this? And you're going to want to tell everyone about it. So it does sound cold and unpleasant when you first hear it. But when it's done correctly, it can be profoundly regulating and useful, especially in the early stages of respiratory illness, sinus congestion, headaches, sore throat, immune activation. And in some kids who run hot and can't settle, it is truly magic. So the way it works is you warm the body first. This is not optional. You want the body to be warm. You don't put cold, wet socks on a cold person. So you warm the person first in a hot bath or a warm foot soak or by getting them fully warm under blankets. And then you take a pair of thin cotton socks and you put them in cold water, and you're going to wring them out very well. So they're still damp, but they're not dripping. And then you're going to put them on your feet. Over that, you place a pair of dry wool socks, and you want those to be pretty thick. They certainly can be thick, dry, just warm socks, but ideally they're wool. And then you go to bed. You're going to wrap yourself up, get all cozy in bed. And this is when the magic happens. And it's really not magic, it's physiology, but kids like to call it magic socks, and that sounds a lot better than wet socks. So the initial cool stimulus of those wet cotton socks that you wrung out creates a circulatory response. So the body's going to move blood toward that area and then warm the socks. And over time, there's a pumping effect with increased circulation, reflex movement, nervous system engagement, and then a settling in response. And it supports immune activation. It will improve congestion. It'll move congestion down. So if you put your kid to bed with magic socks on and they were all congested and stuffy, they're going to wake up without that congestion, and it will help them sleep more deeply. Very often, it will help the fever mount. You might move from that low lethargy, cold phase into the chills phase and then past that. And by morning, those wet socks are dry. And that tells you something. It tells you the body worked, the body responded, the body mobilized, and this can be used several nights in a row. And it is magic. Of course, not every person loves it. Not every child tolerates it. And if someone is really, really depleted or frail or chilled and cannot get warm, like they're just shivering and shaking and they hate the sensation, that also matters. You do want to listen to the body in that situation. So we work with the person in front of us, but when it's used appropriately, it's one of those simple home hydrotherapy tools that can do far more than you ever expected. And once you've seen that work, this is usually where I can convince patients to try some constitutional hydrotherapy at home on their own, which is a little bit more involved and usually done in the office at first, but the principles are still the same. Because at its core, using water as therapy is about improving circulation and helping the body to move blood and lymph where it's needed, and just supporting that lymphatic flow, which is a huge part of your immune system, and stimulating your yeast, stimulating the organism without forcing it and definitely without turning off the immune response. So at home, when I'm talking about constitutional hydrotherapy, it might not look the same as when we do that in the office, which I can have a whole episode on. And I'd love to have a friend of mine on who does a lot of constitutional hydrotherapy with her patients. But essentially, we're using hot and cold therapy strategically. So the simplest example of hydrotherapy I've given before is where you take a bath and you end in cold, and ending with a cold shower is going to increase your immune response. But you could also just use warming chest compresses. You can alternate temperature on the feet or lower legs. When you have a headache, for example, you can put a cold, wet cloth on your head and put your feet in a warm foot bath. And that's going to also move circulation, move congestion, and help with pain of that headache. We might use steam inhalation as part of hydrotherapy. So acute home care is definitely going to include steam inhalation if we have something going on in our respiratory tract or in our sinuses. We might be using essential oils with that too. I don't have enough time to go fully into essential oils here, but the point is to use temperature and hydrotherapy as information telling your body to eliminate, to circulate, and to turn on the immune response further. And when we're using steam specifically, hot steam can help loosen mucus and moisten tissues. Most people are aware of that. We know, oh, I get in that hot shower and everything starts moving and feeling better, right? Standing in a steamy bathroom or even in a bowl of hot water in the shower can be really, really useful. And if you want to get a little more advanced, you might add a little bit of thyme or essential oils, as I mentioned, maybe some eucalyptus or peppermint or lemon or oregano oil, which is really, really strong. I would give more specific guidance to a patient around some of those volatile essential oils. But warmth and moisture alone can do a lot. And if you add in herbs, even better. Okay, so let's move into the natural medicine cabinet a little bit. And again, these episodes are going to do my best to cover a lot of things, but there's so much that can be done as far as building your at-home natural medicine cabinet. So the foundation, as we said, is always rest, warmth and cooling based on stage, hydration, nourishment, hydrotherapy, and then we're adding remedies. So one of the oldest and most beautiful parts of naturopathic medicine is this: knowing how to work with simple substances well. And garlic is a perfect example. So garlic is not just food, it is medicine. Fresh garlic has antimicrobial properties, yes, but I want to be even more precise than that. So it's also warming and moving and penetrating and mobilizing. It helps the body respond to infection, but the way you use it matters. So everyone might have heard, like, eat fresh raw garlic when you're coming down with something, with a sinus infection, for example, but you actually need to crush the garlic. That's completely different than whole garlic. And it's totally different than garlic when it's cooked, which has cardiovascular protective effects. So when we crush garlic and we allow it to sit for a little while before using it, there are biochemical changes that are occurring that make some of its active compounds more available for our body to use. So if I'm using garlic medicinally, I'm not just swallowing a whole clove. That's also kind of weird, but I'm crushing it and chopping it finely. I'm letting it rest for a few minutes, and then I'm using it. Now, it might be mixed into honey for an older child or an adult in small amounts. One of my tricks is to add it to broth. So if we don't like the taste of crushed raw garlic, but we want to use it as an antimicrobial and immune modulator, we can just put it into our soup, and you're not going to taste it as much, but it's still raw. It can be added to food. I often put it in with peanut butter and honey. That's another trick of mine. And it can be taken very aggressively in higher doses for some people. Again, I might be giving more guidance around making a mixture of raw garlic, maybe cayenne, honey, lemon, and apple cider vinegar. That's a really potent mixture. I might be counseling around fire cider and using garlic in many, many different ways. But It can aggravate sensitive stomachs. It can aggravate reflux. So it's not for everyone. So if you're already nauseous or depleted, we might not be mashing up a bunch of cloves of garlic. But if we match the remedy to the person and we know that we do well with garlic, it can be a really profound food as medicine tool. Onion is another one that people underestimate. I always have an onion in my kitchen. Now, I might be using onion for chest packs. I might be using it for earmuffs with patients. I might be using it for a cough syrup. And onion is warming, it's moistening, it's moving. Onion and garlic are in the allium family. So again, I can go so deep into herbalism and botanical medicine, but I really just want you to get the feel for the fact that your kitchen can be your pharmacy. Onion is so deeply useful in acute congestion, and an onion poultice or a chest pack is one of those old remedies that sounds very simple until you see it work. So you take an onion and you're going to gently warm it. So first you're going to chop it up, take that onion, dice it, and then you're going to put it on the stove in a pan and you're going to warm it. And you want to start to warm it so that it starts to turn slightly brown, but you're not browning it fully. It's just starting to release its juices and you're starting to smell it. And you're going to take that and put it into a cloth. So you can flatten a towel, a dish towel, or a cloth on your counter, and you're going to pour the onion into that. So again, it's just warmed. It's not raw, but it's not cooked. And then you're going to wrap it like a little burrito. I like to make a little square with it. This is something I did with my daughter so much when she was a baby. So now I'm just picturing her as a 1-year-old and making these onion chest packs. And you're going to take that burrito and you're going to put it over the chest. Now, this can help with cough, with congestion, with sinus infections. It's even just relaxing outside of the fact that it has antimicrobial abilities because you're inhaling that active antimicrobial ingredient. You don't want to burn yourself. So especially if you're doing it with a kid, check the temperature. But you're going to take that little burrito that you made, you're going to put it on your chest, and you're going to just lay down, rest, and inhale it. When she was young and she was kind of loving it because she loved this, I would open it up too as it started to cool and get a little more of the inhalation and the steam. And it's just such a wonderful, simple remedy. You can even use onion when you have an ear infection as an earmuff, and I'll probably talk more about that in an ear infection episode, but there's just so much value in thinking about what we have in our kitchen at any given moment that then becomes habitual and it becomes something that we reach for, something our kids love to use, and it's amazing. Next thing I always have at home, which I've mentioned, is ginger. So yes, this is one of my favorite acute care medicines, but it's also one of my favorite daily digestion and circulation medicines. So fresh ginger root, just sliced and warm water added to it, is warming, it's circulatory, it's diaphoretic, so it's going to help promote that good fever response we want. And it's supportive for nausea. So maybe this is a GI case and they are also experiencing nausea. So ginger's great for that. And essentially, it can help in the fever stage by encouraging peripheral circulation and sweating. And it's also going to help the stomach in viral illness or digestive upset. So a strong ginger concoction in the early phases of a cold can be wonderful for a person who's chilly and achy and congested. But if they are running really hot and dry and irritated and they don't want any more warmth, then we might shift to a gentler or more cooling or soothing, moistening herb. Thyme would be a great example of that, which you might also have in your kitchen. Thyme is wonderful for the respiratory tract. It has antimicrobial qualities. It has an affinity for the lung and upper airways. And a thyme tea or steam, again, using hydrotherapy, can be useful when you have a cough, mucus, or congestion. Sage is another that you might have at home, and it can be a wonderful throat herb. Warm sage can be used as a gargle or a tea, and it's soothing and antimicrobial for those sore throats if that's part of your acute symptom picture. Chamomile tea, also another underappreciated in acute care. It's very calming for the nerves. It also acts on the GI tract. It's going to help support rest and ease tension and inflammation. And it can be used in kids and adults. So my daughter knows the moment that anyone says they don't feel well, she says, "Do you have ginger and chamomile tea?" It's become her kind of go-to along with homeopathy. So as you use these things at home yourself, if you do have kids, you can start to engage them in at-home acute care as well. Elderflower and yarrow are some more classic fever herbs, and they help the body move fever through rather than suppress it. Again, we're never suppressing the body in naturopathic medicine. Elderflower, yarrow, peppermint, all in different formulations, are traditional for supporting sweating and circulation. Again, you have to know the person and what stage they're in, but this is an example of how herbalism can work with physiology rather than against it. I also love the category of mucilaginous herbs for you to have in your at-home medicine cabinet. So mucilaginous herbs or demulcent herbs, such as marshmallow or slippery elm, help when tissues are dry, inflamed, and irritated. So if you have a sore throat and a dry cough or post-viral irritation, these are times when moistening demulcent herbs like these can be such a blessing. Everybody probably has honey in their kitchen, and it's especially great for a cough and for throat irritation. And it's definitely not for infants under 1 year of age, of course, but for older children and adults, honey is deeply soothing and often more effective than people expect. You can do honey with thyme or honey with garlic, as I mentioned before, or honey with flax. So there's lots of different ways to use honey. Local honey is great for seasonal allergies, honey that's local to your environment, so that it has actually been created by the local bees that have local pollen. So if you have an allergy to the local pollen, you can use the local honey. I told you I'm going to do a whole allergy episode next. And then there's lemon. So warm water with lemon is something that I'm counseling patients around using every morning. So we're getting that vitamin C, we're getting that digestive stimulation, we're getting that detoxification, but it's not too simple to mention here in acute care either. If we're doing lemon water, we're helping with hydration, we're maybe soothing that throat, we're again stimulating digestion, and we're moving things through the system. So obviously remembering that lemon can be something we use every day, but certainly at the sign of illness, lemon can be a really powerful tool. So I want to go a little more in depth with immune supportive botanicals. And I think this is important because not all immune support is the same. So if you don't understand that, you might be undertreating or overstimulating a system that doesn't need stimulation. So there's a difference between immune stimulation, immune modulation, and antimicrobial intervention. And acute illness is where that distinction really does matter. So I do want to mention medicinal mushrooms. And I don't mean psychedelics. I mean mushrooms as not just immune boosters, but immune modulators. So the beta glucans in mushrooms are essentially what we're using for immune modulation. So they're not just pushing the immune system up, but they're help regulating how it responds. And so especially in patients who are burned out and inflamed and maybe have autoimmune processes going on and they're really dysregulated, the problem is not always a weak immune system, it's a confused one. And so mushrooms can be really great for this. So you might be using cordyceps or reishi or shiitake or maitake or turkey tail. And I'm thinking more about let's support intelligent immune regulation when I'm using them. And I might use them more in prevention and recovery, but you can definitely also use them acutely, and they can be used in food as medicine as well. So they might not be used as acutely, but I do think they're really important to mention because they're building terrain and they're really building a regulatory immune response. Now, if you compare that to something like a formula or an immune tincture or a combo product, maybe something similar to Immunotone, which I use a lot, that has elderberry, echinacea, astragalus, and other immune supportive herbs along with mushrooms, now we're in a little bit of a different category where we might use that acutely to support an immune response in an acute infection. So elderberry is going to be more antiviral, more acute phase supportive, whereas echinacea is stimulating and mobilizing, and astragalus is more tonic and preventive. So this is where clinical timing does matter because you might be using one of these before an illness or in recovery or in people who get sick often, and you might be using some of them more with a fever in that acute infection stage. So again, it's about learning your tools. Because echinacea helps mobilize, it can be really helpful early on, especially in someone that does have a strong constitution and you're trying to direct some of that immune energy. Whereas elderberry and its antiviral action can be really supportive in upper respiratory infections or other viral load. And it's generally really well tolerated. I use it a lot in kids. And this is going to be different than an antimicrobial. So, yes, when we talk about food as medicine, like garlic, we might be using that as an antimicrobial to kill off bacteria or growth, right? Golden seal is a great option here. So we're going to very clearly be moving into antimicrobial territory when we use something like golden seal. You might use a golden seal echinacea throat spray, for example. And golden seal is strong. It's not a daily tonic. It's something that I use intentionally. So it has a strong affinity for mucous membranes, sinuses, throat, gut. It's drying. It's again antimicrobial. It will kill things off and it can be very effective in the right context. But if you use it too early, it might suppress some of those natural eliminative processes that we've been talking about. So if the body's trying to move mucus through and you aggressively are drying it up, you might inhibit some of that mucus clearance. So I'll definitely use golden seal when there's thick, stagnant, lingering mucus and something's not resolving, or there's sign of bacterial overgrowth or secondary infection, maybe when the tissues are boggy and heavy and stuck, but I might not be using it in an active, watery phase. So again, as you're building your at-home medicine cabinet, you're starting to think in layers and in how you use herbs and food as medicine at different times. So mushrooms, terrain, modulation, resilience building, prevention of being sick, immune formulas, timing's going to matter. The phase that you're in of the infection is going to matter. Echinacea, we're using early to mobilize the immune system. Elderberry, we're using as an antiviral. Astragalus, we're using in prevention and the rebuilding phase. Golden seal is more targeted antimicrobial. So this is, again, shifting us from what do I take, what should I take, to what is happening and what type of support matches what's happening in my body. Because when you understand that, your interventions are a lot more effective because you're not just throwing things at the body because it's good for the immune system. You're really practicing medicine. And we can get even more nuanced with zinc and vitamin D and vitamin C and high-dose vitamin A as an antiviral. But I really just wanted to start introducing you to the concept of having this at-home toolkit. Okay, now let's talk about homeopathy because this is where people often become, I think, overwhelmed with there's so many remedies that we can grab. But homeopathy in acute illness can be incredibly elegant when matched well. And so if you just start to learn some homeopathics, I have a homeopathy family kit and a handout that I give patients. So there's about 20 remedies on there. And even if you just start with 5 and you start getting used to the ones that you tend to need when you're sick, it can be such a wonderful tool to learn how to use. So the principle is the same as everything else that I've said. We look for patterns. We look at the quality of symptoms, the onset, the overall picture, and then we select the remedy that's indicated in that situation. So I'm going to go through some of the remedies that I might recommend patients have at home for acute illness. Aconite is the classic remedy that we might talk about at the beginning of an acute illness, especially if there's been sudden exposure to cold, dry wind, a sudden fright, or a really abrupt onset of symptoms where the person goes from well to unwell quickly. There's often intensity to their symptoms, fear around the symptoms, restlessness, and the suddenness. So sudden onset, think aconite. Belladonna is different. Homeopathic belladonna belongs more to the hot, flushed, throbbing, red, bright-eyed stage. So you might have a sudden fever with a red face and dilated pupils and heat pulsing out of your system. And maybe there's a pounding headache and a lot of sensitivity to the environment. especially in kids who get fevers that are really hot and intense. And again, red is a keynote. Belladonna is what we're going to reach for. And then we have ferrum phosphoricum, and that's one of the remedies that is probably underused a little bit because it works really well in that early inflammatory window before things get traumatic. And in that phase, that's when patients are sometimes pushing through, remember? And it's great for an early sore throat, a low-grade fever, and that first stage of inflammation. So if you get good at noticing when that fever response is starting and mounting, and maybe you're using your hydrotherapy, it's a great time to use ferrum phos. And then gelsemium. So gelsemium is drowsy, droopy, slow. It's this heavy, droopy flu state remedy. You've got heavy eyelids and you're weak and you're dull, and it's that flat, weighted feeling. And very often that comes not maybe at the immediate beginning of your symptoms, but pretty quickly you start to feel that heavy feeling, and reaching for gelsemium is a great idea then. Bryonia is for dry, irritable, wants to be left alone, worse from moving around in motion. So they just want to rest, but they're often really, really thirsty for large amounts. They might have a headache, body pain, dry cough, and they just want stillness. That's bryonia. Pulsatilla. My daughter was a pulsatilla constitutionally as a kid. So, well, she's still a kid, but as a baby. And constitutional and acute homeopathy are different things, but I don't have the time for that here in this episode. But pulsatilla can show up in a clingy, weepy child. They've got thick, bland mucus. They're emotional. They want fresh air. They want comfort and open air. Sometimes they want to be carried. She used to sleep with her arms up above her head, which is another keynote. And then nux vomica is really great when there's irritability, oversensitivity, digestive disturbances. Maybe you've pushed too hard and you were eating poorly and not sleeping, and now everything is really reactive in your system. Arsenicum album is one I'll use when we have anxiety, but also GI symptoms. So maybe burning sensations, exhaustion, and agitation, but it can also be useful in gastroenteritis where there's vomiting and diarrhea and restlessness and this kind of like anxiety, things moving through the body in a gastrointestinal way picture. So I want to be really clear. Homeopathy is beautifully specific, as you can tell, but if you don't know the remedy, you don't have to freak out. You don't have to worry. You can keep a few well-chosen acute remedies on hand. You can learn them slowly. The goal is not perfection. The goal is becoming more observant and less reactive. And I really want to have a dear friend of mine on the podcast who started out as a patient and now she does some work for me at Roots Deep Medicine. And she's gotten so into homeopathy for herself and her kids. And I think she would just be a wonderful person to interview, or maybe even have her interview me around how powerful this tool can be for your family. Now, I want to give you a little bit of a more concrete example. So we've talked about some of the things we do when we're starting to feel this kind of pervasive sick feeling. Now, I want to move more specifically into gastroenteritis because I think it's a good example of a place where people will either panic or suppress too quickly. And if we suppress, and if we take an antibiotic, for example, then we're knocking our gut microbiome back. And our gut microbiome, our healthy bacteria, are what are going to help our immune system mount a response. So vomiting and diarrhea are miserable. They're depleting. They absolutely can become dangerous, of course, if hydration drops, or especially in young kids or vulnerable adults. So again, we're using judgment, but the first thing to recognize is that vomiting and diarrhea are elimination processes, right? We're getting rid of something. The body is trying to clear something. So if we can support that process versus suppress it, it's going to resolve a lot more quickly. And homeopathy is wonderful in this situation. So you've got ipecac, you've got borax, you've got, again, that nux vomica and arsenicum I mentioned. I've gotten really good with my daughter at the first sign of any nausea. She knows exactly what remedy to pick. So again, a lot of this is from experience is from using and getting familiar with the remedies. Of course, in the beginning, I am teaching patients this, but I want you to just hear that there's all of this available to you as a tool when you are acutely sick. So, if we're nauseous, we might take tiny sips of water. We definitely might use that ginger and chamomile tea. We are going to want to make sure that we get some sort of electrolyte fluid, whether that's a small amount of electrolytes in water or doing coconut water. And the biggest mistake that I see people make in a gastroenteritis is giving too much too fast because they're afraid. And then the stomach reacts and everything comes back up. So small amounts, small sips of water at frequent intervals. And again, getting in a bath if you're able and working with the body is the medicine. And so as they're resting and maybe their vomiting eases, or maybe they don't move on to that phase because we've used some remedies. Maybe we do move on to broth or applesauce or a banana, something really easy to digest depending on the person. Not because those foods are necessarily magical, but because they're gentle, they're low demand on the gastrointestinal symptom. We've been replacing with water and minerals, and we've been resting ideally. And the gut might be really irritated as we recover from something like that. So maybe we do talk about some of those demulcent herbs that I mentioned before, those mucilaginous herbs. Maybe we do use even glutamine, which is an amino acid, which can heal and seal the gut lining. Maybe we're adding in that ginger and chamomile and peppermint. And homeopathically, as I mentioned, we're maybe considering that arsenicum or podophyllum is a great gastrointestinal remedy. But again, only as we get used to knowing what to use. Maybe we're using aloe. So we watch as we start to use the remedies. We notice how the symptoms are changing. Is this person able to keep things down? If the symptoms are getting better and we're using homeopathy, we tend to pause on dosing. So a lot of this, as you can see, is listening to the body. What stage is it in? And I think this can be where the naturopathic mindset might be misunderstood. You might think you're not doing anything, and that couldn't be further from the truth. We're not suppressing physiology thoughtlessly, but we're also not ignoring red flags. We're watching, we're assessing, you escalate when needed. And I think that's really good medicine. And when we need to work up the therapeutic order and intervene, we can, but we have these foundational tools that can work with the body to resolve an acute infection and that can resolve symptoms and help them move through. Certainly, if we're working through this process and someone's not breathing or oxygenating well, or they're so lethargic, or they're completely out of it, they're so dehydrated, their fever's really high, it's above 105, then of course there's a time and a place to escalate. Of course, I'm telling patients go to urgent care or go to the ER if need be. So again, this is not about being irresponsible. This is about tracking what is going on in the body and knowing how to support it. And when your clinical intuition says you're moving out of your range or your comfort zone, obviously knowing that there's a time and a place to escalate. So I don't want you to take from this episode that we never do anything more than these at-home tools, but this is a great start for you to just start to learn how to use at-home remedies. And last, I do just want to touch on when you start feeling better and you think, oh, I'm just immediately going to resume normal life, that can be a little bit of a mistake. And so we might go right back to our coffee and alcohol and pushing ourselves through the day and never really completing the arc of healing. So resolution is also a phase, and it's helping your body rebuild. It's continuing to move mucus out. It's continuing to support your energy, focus on sleep, focus on hydration, getting healthy foods throughout that process, right? Maybe our bowels are still a little off as we recover from that gastroenteritis, or cough might be lingering. So this is not always pathology. It's simply the body finishing its job. And if we still have symptoms, that tells us that the body might need a little bit of support in that area. So we continue hydrating, we continue with warmth and those Epsom salt baths and prioritizing rest and not adding in inflammatory foods and sugars and things that would feed an infection. And we nourish, right? And we rebuild the terrain, maybe vitamin C rich foods and broth and minerals and probiotics and gut support if that illness didn't involve the digestive tract. And if you did use antibiotics, certainly repopulating the gut with probiotics and prebiotic foods. And maybe we do continue using our demulcent herbs like slippery elm or marshmallow to continue to soothe that irritated mucus lining. And we gradually return to more movement. We're consistently getting out in the sun and getting that fresh air. We have our whole episodes on sunlight and vitamin D, and they're absolutely important in this at-home healing. I just didn't have time to mention them fully here. And we really focus on letting the body complete the healing process. This matters so much, especially in perimenopausal and menopausal women who are maybe already running on empty. And when our body has an acute illness on top of a depleted terrain, this is when it might be harder to bounce back. So noticing how well is my body able to recover is part of the whole health awakening journey. Because the acute illness, the germ, is never the whole story. The terrain is the story. And that's why I really want people to stop thinking of acute care as separate from the rest of their health and as something that we're suppressing symptoms in this phase. We're not. It's not separate from the rest of your health. How you move through an acute illness reveals so much about your terrain. And when you suppress, you don't learn that. And acute illness can reveal your hydration habits, your nervous system flexibility, your inflammatory tone, your nutritional status, your vitality, how stress is impacting you, your ability to rest, your willingness to listen to your body. Acute illness is not just interruption and annoyance, it's information. And if you can learn to have a relationship with how your body responds in these times, even in those difficult moments where you don't feel good, it becomes part of how you build health going forward instead of something you fear. If you're just listening and you're not a patient, I really want you to learn that your body's symptoms are not things to be afraid of. So when someone in your home starts to get sick, I want you to think like this. First, what phase are we in? Are we in the early signaling phase, the hot active phase, the elimination phase, or the rebuilding phase? Second, what is the body trying to do? Is it trying to warm up? Is it trying to sweat? Is it clearing mucus? Is it trying to rest? Is it trying to tell me to sit down? Is it trying to empty the gut? Is it reducing appetite? Is it asking for stillness? And third, what support matches that phase? Do we need to give warmth? Do we need to heat the body? Do we need to give fluids to move things through? Do we need to give steam to break things up? Do we need to add the wet socks in for congestion and immune support? How about some honey or ginger? Do we need a sage gargle? Do we need to just observe and rest? And then fourth, are there red flags? So is breathing compromised? Are we clearly dehydrated and unable to keep anything down? Is our fever excessively high for a long period of time? Are we unresponsive and feeling severely sick? Well, then yes, we're going to do more about it than just these at-home tools I'm talking about, right? And then fifth, how do we close the healing cycle and move on to resilient recovery? And this is all the difference, right? This is shifting from fear-based symptom management to relational medicine working with the VIS. This is the shift from symptom suppression to support. So many patients that work with me create these at-home medicine cabinets, and then they don't need me anymore, which is really my goal in the work that I do. And I do want to say you don't have to be rigid and dogmatic in this. I have been doing this for a very long time. So no, I don't have any over-the-counter or any pharmaceuticals in my home. And I'm not judging patients that do. Sometimes you might need a fever reducer, you might need urgent care, an infection might need antibiotics. I genuinely full on practice what I preach at home, and I don't need those things. So I can instill knowledge around what to do at home without them, but I don't expect that every patient will be there or that you as a listener will be there. So I'm not saying there's not a time and place. I'm not saying you've failed if you use any of those other tools. I just want to give you some ideas about what else is out there. This is not a competition to prove how natural you are. This is about learning how to see the body more accurately interpret less reflexively, support it more intelligently, and know when to watch, when to act, and when to escalate. And that's real at home medicine. And I think it's a skill worth building because most people have been taught almost nothing about what to do at home other than suppress, numb, wait, or take an anti. And I think we can do better than that. I think we can remember more than that. And I think we can become more skillful at how to use nature cure tools when we are sick. And I think that that prevents future sickness. And there's something so deeply empowering about knowing how to respond to illness in your home with more calm, more clarity, and more trust. And it's the kind of deep trust and knowing that comes from paying attention, that comes from understanding physiology. That's why so much of what I do is teaching. And it comes from recognizing that the body is not failing, it is trying, and our work is to help it overcome those symptoms. And that is acute care at home. So I hope this was helpful. I think next week I'll dive into allergies because allergy season is upon us in Connecticut. And some of what we learned today, we can apply next week. So if this resonated with you, please subscribe and download the episode. And as always, share it with someone who you think can benefit from this type of medicine. Have a great day.